In today's healthcare environment, effective staffing and care delivery models are crucial to ensure high quality patient outcomes. This presentation will explore various nursing care delivery models, their impact on patient care, and the significance of appropriate staffing levels in enhancing care quality. We'll discuss strategies for optimizing nursing resources and how different models can be tailored to meet the unique needs of diverse healthcare settings. This is Professor Osorio, and I'm hoping your day is going well. Effective staffing involves ensuring an appropriate number and skill mix of healthcare team members to meet patient needs and provide safe, quality care. This process requires careful consideration of patient requirements, nursing staff characteristics, and the organization's needs within the practice environment to create a balanced and supportive care model. Research supports the positive impact of RNs on patient outcomes, including reduced mortality rates. Key factors to consider when staffing a nursing unit include the number of patients, the intensity of care required. This is how you classify patients based on acuity, the staff experience and training, the layout of the environment, and the available technology. The American Nurses Association, or ANA, recommends that patient classification systems take into account factors such as the patient's age, functional ability, communication skills, cultural and linguistic diversity, severity and urgency of their condition, if there are any scheduled procedures, and the ability to meet healthcare needs, psychosocial support requirements, and other specific needs identified by both the patient and the RN. As the charge nurse, it is important to assign patients based on acuity, ensuring no single nurse is overwhelmed with all the acutely ill or high demand patients. You should also plan for patients returning from procedures, such as a stent placement in the cath lab, where close monitoring is required to prevent complications like bleeding. It's essential to staff the unit with a nurse who can recover, monitor, and treat such patients effectively. For assignments that require frequent checks like Q15-minute groin access and neurovascular checks, the nurse should be assigned one is to one with the patient to ensure safety and proper care. Staffing and staff satisfaction are closely linked in a nursing unit. Adequate staffing ensures that nurses can provide safe, high quality care while avoiding burnout. When nurses feel supported and have manageable workloads, they tend to be more satisfied, right? Which leads to improved patient outcomes, cost effective care, and a more positive work environment. Organizational needs impacted by staffing include financial resources, licensing regulations, accreditation standards, and customer patient satisfaction. Efficient staff management is crucial for maintaining the organization's financial stability, however. Nurse managers are accountable for adhering to budgetary guidelines, which involve managing the number of staff on duty. Optimizing staff mix as well, making sure you have staff for every kind of need that may come, and balancing the use of RNs in the most costly effective way, and also considering how much you're paying other care providers like CNAs, or if you're using nurse practitioners and other providers. The nursing care delivery model outlines the way tasks, responsibilities, and authority are organized to provide patient care. It specifies which healthcare worker will carry out certain tasks and who holds responsibility and who has the authority to make decisions. The core principle is to align the number and type of caregivers with patient care requirements in a cost-effective way. The classic nursing care delivery models include total patient care, wherein one nurse is responsible for all aspects of patient care during their shift, functional nursing, which means each nursing staff member is assigned specific tasks based on their skill set. And team nursing is a team led by a registered nurse who provides care but also delegates tasks according to each member's expertise. Primary nursing is when one nurse manages the patient's care plan throughout their stay. These models have been adopted to enhance both the quality and cost effectiveness of patient care. In total patient care model, the nurse is responsible for all aspects of the patient's care during the assigned shift. This traditional model is sometimes called case nursing. It is commonly used in nursing education where students provide complete care for their patients. The pros of this is that it provides cohesive care, allows for autonomy, and minimizes fragmentation in the care that's provided to the patient. The downside is that it's costly. It requires a high number of RNs and involves RNs in tasks that may not utilize their full skill set. So for a very quick reference, in cardiac surgery ICU, we usually have more nurses than we have patients, just because of the complexity of our patients. And because in this stage in the recovery process, our patients typically require total patient care. In functional nursing, what's involved is that specific tasks are assigned to various staff members based on their roles. For example, there may be an IV team, a medication nurse, and a team for patient mobility. So this is very ideal. The RN nurse manager allocates tasks to a group of healthcare workers. Also, she plans the care, supervises the workers, and retains overall accountability for the patient care provided. The pros of this is that it's cost effective, it allows more ancillary staff involvement, but the downside is that it can become mundane for staff. It may confuse patients sometimes, often results in more fragmented care, and may involve delays as patients wait for the appropriate staff member. An IV therapy nurse, say, performs functional nursing in their everyday duty. A good example of this also is when post-operative patients are not seen by PTOT promptly due to the limited number of therapists available to attend to the numerous patients in the hospital. Occasionally, patients who require post-op teaching on day one due to their physical limitations from the sternotomy may be overlooked and not seen until day two. This results in a delay in care. While nurses can provide the teaching, it is ideally a task for PTOT as they are the experts in this area. In team nursing, the RN team leader oversees and coordinates care for a small group of patients while utilizing ancillary resources. The nurse's responsibilities include planning and organizing patient care, assigning duties to team members, directing, supervising, and assigning the team. And this nurse would also be providing direct patient care. He or she maintains accountability for all aspects of patient care, and the RN team leader fosters a cooperative environment and ensures clear communication within the team. The pros is that it offers one-on-one care, similar to the physician model, and the cons is that it may require being on call, which is not always ideal. The medical surgical unit is a good example of this. In modular nursing, or it is also known as pod nursing, is a variation of team nursing where the patient unit is divided into smaller, self-contained modules. A consistent team of caregivers is assigned to each module with an RN as a team leader. The goal is to enhance RN involvement in planning and coordinating patient care. Each module is stocked with all necessary supplies to boost efficiency. The pros is that it involves quality and efficiency of care. The cons are that it's could be a source for potential confusion or creation of silos if team members are absent. It also risks having too many leaders. An example of modular nursing is when nurses worked in an isolation room or ward, such as during the COVID pandemic. At one point, we transformed an entire ICU wing into a dedicated COVID ward. This approach not only helped contain the virus, but also allowed other nurses to remain quote unquote clean and unexposed to COVID patients. Now, this was crucial since we were still managing highly vulnerable patients, including post open heart and post heart transplant patients. Primary nursing is a model where the RN, known as the primary nurse, assumes 24-hour responsibility for a patient's care from admission through discharge. This nurse provides total care while on duty. When off duty, an associate nurse continues the care according to the plan established by the primary nurse. So this model allows for comprehensive care management, which is common in areas like case management and hospice care. The partnership model, or co-primary nursing, involves an RN working consistently with an LPN or an LVN or a nursing assistant. So this model is a modification of primary nursing aimed at efficient use of the RN's skills. The RN is responsible for planning, coordinating, assigning tasks, and supervising the partner while also maintaining full accountability for the care of all assigned patients. Does this sound familiar to those of you in preceptorship? Take a minute to answer this question and pause the video. The correct answer is B, because one advantage of team and functional delivery models is that quality, comprehensive care provided with more ancillary staff. A is incorrect because total patient care and primary nursing use RNs for all aspects of care. And C is incorrect because although functional nursing allows ancillary staff to perform tasks within their scope of practice, total patient care requires an all RN staff that performs all aspects of care. And D is incorrect because although team nursing allows a team leader who is an RN to coordinate care among diverse levels of team members, primary nursing requires RNs to perform all tasks related to the care. Patient-centered care is defined by the IOM, or the Institute of Medicine, as providing care that is respectful of and responsive to individual patient preferences, needs, and values, and ensuring that patient values guide all clinical decision. This approach involves nurses, physicians, and other health professionals partnering with patients and their families to ensure care respects the patient's desires and preferences. While it is not a specific nursing care delivery model, it is a vital philosophy of care that underlies all nursing care delivery models. And again, patient-centered care involves engaging patients and families and significant others as active partners in care. The key methods include involving them in the development of care and discharge plans, including them in change of shift or handoff reports, providing information and education to support informed decision making, and establishing family advisory councils to involve patients and families in healthcare decisions. Again, pause the video and answer this on your own. Give it a minute. The correct answer is C, because patient-centered care is to provide care that is respectful of and responsive to individual patient preferences, needs, and values, and that patients and family members are involved in all care decisions. Nursing case management is a collaborative approach to coordinate a patient's care throughout the course of their illness. The nurse case manager oversees a caseload of patients, managing their care from pre-admission to discharge, aiming to coordinate healthcare services, identify and facilitate options for meeting health needs. Does that patient require home health? Do they require going to a rehabilitation facility, a skilled nursing facility? Are they going to be okay at home with just some family support and services? They also aim to reduce fragmentation and duplication of care and enhance quality and cost-effective clinical outcomes. So this model not only provides effective patient care, but also reduces expenses for hospitals and insurance companies. Often, the primary care model is integrated into case management. This is why there's a running joke in the hospital about who wears the longest white lab coat in the hospital. And the joke is that it's the case managers that wears the longest lab coats in the hospitals. And going back, some insurance case managers work remotely, which I find quite fascinating. Their role involves reviewing charts to ensure that all procedures and medications billed are necessary. Or sometimes they're on the opposite end of that. They work for the hospital to make sure that the hospital does all the necessary procedures and have given all the necessary medications in order to then bill the insurance. During COVID, there was a period when hospital nurse case managers also worked remotely, which added more strain to the primary nurses, as we then had to handle additional tasks. It raises a concern. How can case managers effectively coordinate care and manage discharge needs without firsthand knowledge of the patient's functional abilities? While they can review the chart, it only provides so much information, right? You have to actually go see the patient. Case management is a supplemental approach that complements existing nursing care delivery models, focusing on planning and evaluating care rather than direct patient care. The RN case manager typically oversees cases involving the chronically ill, seriously ill, or injured, and long-term high-cost patients. This method does not replace the direct care model, but works alongside it to ensure comprehensive patient care. Newer models of case management have developed in response to healthcare reform and the push to transition patients to more cost-effective home and community care settings. Now remember, it's very expensive for patients to be in the hospital for a longer period of time. So we really need to get them out there in the ambulatory care settings or to receive resources at home. Now, the newer models of case management include patient navigators. They guide patients through the complexities of the healthcare system, including navigating through various providers, facilities, insurance processes, and support organizations. So this is truly, truly beneficial to patients. There are also transitional care RNs, which aid chronically ill patients in moving across different care settings, ensuring seamless communication, adequate follow-up, understanding of medication, and support with referrals, while also engaging patients and families actively in their care. These models often meet the requirements of centers of excellence and serve as a stopgap to address care transitions. Clinical pathways, which are also known as clinical paths or practice protocols or care maps, are predefined evidence-based plans of care tailored to specific health problems such as heart failure, pneumonia, strokes, and hip replacements. They outline desired patient outcomes and the interdisciplinary interventions required within a set time frame. These pathways help manage complex medical diagnoses and common nursing care needs. They are often required by regulatory bodies like JCO, so if a patient's progress deviates from the pathway, this is referred to as a variance. So hospitals or big surgical centers specifically doing your ortho cases are very strict with who they partner with for the post-acute care of their patients because they don't want any variation. Because insurance will only pay for the non-variations. They only pay for the procedure if all went well and all went according to the pathway. Whatever is extra, whatever is a variance, insurances will find a way to not pay for. The essential components of clinical pathways includes the physical assessment guidelines, laboratory and diagnostic tests, medications and procedures, the safety and self-care activities, nutrition, patient and family education needs, discharge planning. So these clinical pathways may also address triggers for potential or actual variations in the patient's response to the planned interventions. Here is a summary of the nursing care models used in different healthcare settings. In the emergency department, they utilize functional nursing due to the focus on efficient assessment and immediate treatment. It has to be fast, it has to be efficient. Medical surgical units frequently adopt team nursing to ensure a collaborative approach to patient care. That one nurse can't answer all 4 or 5 work call lights when they go off after breakfast. Critical care units often use total patient care, allowing for direct and comprehensive nursing responsibilities. Home health agencies, they may implement primary nursing to ensure continuity of care from admission through discharge. Blended models is when over 50% of nursing staff in hospitals have reported using multiple care models within a single shift, indicating the flexibility and adaptability required in healthcare environments. So I think that most of us do practice in blended models, though. The evaluation of nursing care delivery models focuses on two key aspects. One is patient outcomes. Are the outcomes achieved in a timely and cost-effective manner? And two is the nursing process. Does the system support the effective implementation of the nursing process? Now, these considerations help ensure that care models are both efficient and aligned with patient-centered care goals. Here are some questions that you could pause the video before continuing on and try to answer them on your own. So for number one, determining nursing staff and patient Assignments are based on which fundamental component? That would be acuity levels. And two, accrediting and licensure agencies such as the Joint Commission address staffing by D, ensuring patient receives satisfactory care. Here's another question. Pause and try to answer on your own. During orientation, a new RN graduate is told that a team nursing model is implemented in the hospital. He knows that planning delivery of care will be based on, so A says the task approach. What is that? That's typically functional nursing. B, providing the care to a group of patients from admission to discharge. That is typically primary nursing. Managing the care, C, managing the care concepts and tools while providing patient care. That is case management. And D, nursing personnel are led by an RN in providing care to a group of patients. Now that sounds like team nursing model. Thank you for your attention. Please send me questions through office hours, text, or email, and I hope you have a splendid day. See you in class.